Singapore's Health Minister Ong Ye Kung says it's now important to boost vaccination. The daily rate of inoculation has been boosted and there is capacity to administer more. However, there are also supply constraints. Cheryl Goh reports.
Even with COVID-19 vaccinations in full swing, the task force says vaccination levels in the country are not high enough. At the moment, 2.7 million people have received at least one dose of the vaccine. This means about half the population are partially protected from the virus, while another 35% are fully vaccinated. For seniors above 60, a key vulnerable group, 3 in 4 have received both jabs. The task force notes that a daily average of 1,000 of them are still walking in to get their shots.
Our vaccination rates will have to be higher so that all of us are better protected. It will go higher in the coming weeks, and we are vaccinating as fast as we can, but we are only constrained by supply. We have the capacity to do a lot more, but we are constrained by supplies and how many vaccines arrive in Singapore.
In the first 2 weeks of June, 47,000 doses were administered daily, up from the 40,000 in May. The task force says there is capacity to administer even more, subject to the delivery of more supplies. As for the effectiveness of the vaccines, the Health Ministry looked at the data of 29,000 people quarantined in Singapore. It found that vaccines offer around 79% protection against the virus. A similar study done in the UK found that it provided 88%. Vaccination also reduces the risk of an infection developing into a severe illness. The task force is also urging people not to wait for a particular vaccine, as both have been approved and are safe for use.
The mRNA vaccines come in batches into Singapore, but they are not synchronized one with the other, so they come at slightly different paces. You may find that at certain times, one particular mRNA vaccine is more available than the other.
Professor Mark is advising people to take up vaccination slots as and when these are available.